Hello, we're going to introduce WEZESHA to you today in an innovative way, if I may say. So stay and watch.
May your wishes all come true. May you always do for others and let others do for you. May you build a ladder to the stars and climb on every rung. And may you stay forever young. May you stay forever young.
We'd like to introduce to you WEZESHA, which is for us a new
Strategy.
Identity.
Business model.
A new wow.
What's the wow?
It's a way of working.
Care.
Focus.
Being at the center.
Networking with partners.
Instigating action.
Innovation.
adventure.
Being a partner. Building capacity.
It is a strategy.
May you grow up to be righteous. May you grow up to be true. May you always know the truth.
So while the WEZESHA program builds on the foundation of 20 years of CARE's work in Tanzania, it embodies a more focused approach, informed by our 12-month-long CPR process, which is designed to increase our relevance, our efficiency, and our effectiveness. WEZESHA will improve program quality and impact as a result of the thematic and geographic focus. The focus will allow us to further improve our program processes and data quality and have a more unified results framework and learning approach in CARE Tanzania. The improved integration and coherence in our programming will not only result in increased efficiency and effectiveness, but also allow us to better demonstrate our contribution to social change within our impact group of women in food insecure households whose livelihoods depend on natural resources.
I think we've made a lot of progress. We will continue to emphasize in championing and living our core values. In terms of skills, we met almost 2 years ago, and we identified the competences that will take us to during the transition. For example, strengthening partnerships, communicating with impact, evidence-based advocacy, etc. And we've started doing the sessions where we develop these competences. I think we are all excited that the CPR is now approved and we will move to our next, or I should say, new care. And yeah.
There will be several changes in our partnership relations. One, I think the kind of partnership relations we have had in the past will have to change. In the past, we have had this subcontracting or subgranting type of partnership relation. I think that will have to change. The aim now is to have equal partnership, a relationship where both parties feel they have equal say, equal space, and making equal contribution. So that will be one. The second change, I think, will be in terms of our staff attitude. For a long period of time, because of the kind of the relationship we have had, our staff have had the attitude of being in the driving seat and directing and showing the way. So that will be a second change that will have to happen. The third change that will have to happen will be in terms of our policies. We have had policies that have guided the kind of partnership that I have mentioned, the subcontracting kind of partnership. You have 1,001 policies trying to manage the subgrantee. I think you have to have policies that are more enabling to partner organizations that allow for some of the capacity needs to be addressed and to bring the partner organizations to the level of skill that we can all be comfortable with. So our motto now is working as one in a network of peers.
Well, I know the key word for this for us is sharing. So it'll be sharing a lot more of our successes, our challenges, our achievements, by using the existing platforms like Minerva and The Village, but also building on some new platforms. We're going to start a website. We're now on YouTube and on Twitter. You can find us at Care Tanzania. And we also want to do a lot more internal learning through a lot of learning sessions. We have people come from inside and outside of the office and present at lunchtime, just key, interesting things that are relevant to the work that we do and will keep us innovative and ahead of the curve as well.
We shall continue using gender mainstreaming as an approach towards gender equality, and we will be doing so by, first of all, strengthening capacity of women so that they can be able to understand different opportunities and also different resources which they can use to generate an income and also improve their livelihood as a way of also of reducing poverty. But again, also will be strengthening capacity of women groups, women associations, so that they can engage in different decision-making bodies. And once they engage, that's how they can be able to claim their rights and also hold duty bearers accountable.
I received information about Care Tanzania's decision to phase out education programs with mixed feelings. On one hand, I felt the organization is steering away from a sector that is critical to the development of a poor country like Tanzania, a sector that thousands of children, especially girls, are struggling to access and benefit from its services. While I felt we might be letting down the poor girls, I understand Care Tanzania has to make choices in order for it to be viable and contribute meaningfully to the development of this country.
We're very happy with the New Delhi resolutions because we really think it is important that the Global South is represented in decision-making bodies of care. As part of our strategy, we intend to become an independent CI member, and as a first step, we're going to establish an advisory board with people from the government, partners, and celebrities in Tanzanian society. This is the Care International news. The headlines. Care International has identified a new Secretary General. The board of Care International has adopted New Delhi resolutions. Care Tanzania is launching its WEZESHA strategy. We're now moving to our correspondent in Dar es Salaam, who is interviewing one of the Care staff.
Hello, I'm Jane Ngana, and today I have with me Mr. Paul Daniels. And first of all, congratulations on the new strategy.
Asante sana.
So I have some questions for you. Is Care going to be smaller?
Yes, I think we're going to be smaller. We're going to have a lighter footprint in country. And that is largely because we're going to work increasingly through local partners. So we're not going to be engaged in service delivery, but we will be more a networker and an organization that is engaged in advocacy and research and innovative programming.
What kind of services will Care Tanzania deliver?
Well, currently we're involved in a lot of things, nearly everything under the sun, but some of that we're going to phase out, particularly our education and maternal health programming, and we're going to focus on women empowerment and climate change adaptation in a rural environment. Still, although we want to have our feet in the ground and we'll be engaged in some sort of implementation, are like reducing our level of service delivery, and we will deliver service in collaboration with partners rather than ourselves.
So does this mean Care now is going to be richer?
In the short run, I would say no, because we're phasing out some of these programs. I think our funding levels will contract a little bit. But in the future, I see great opportunities for Care to attract more funding, particularly because climate change and women empowerment are two issues that have worldwide attention at the moment.
And are you going to be affiliated with CARE US in any way?
In the short run, yes, but as you know, CARE is becoming a global organization. It has formulated its Vision 2020, and we want to be one organization with one headquarters. So in the future, we will be reporting to that one headquarters. We don't know where it's going to be based yet, but that is CARE International.
And I thought CARE was all about women. How come you're a man?
Yes, CARE wants to achieve a transformational change in the lives of women, but we have to take men along, and we can only ensure more equity and equality in the relationship between men and women if we involve and engage men as well.
Okay, thank you very much, Paul. And to all our viewers, that is all for this evening.
Bleep, 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 bleep.
Business model.
Yeah. I can't pause. I'm Her Majesty.
Sijui kama itakuja leo ndio. Advocates.
Adventure.
The headlines. CARE International has adopted an identity... No.
While the WEZESHA program is built on 20 plus year... Oh, it's not 20 plus, sorry.
And first of all, congratulations.
Asante sana.
So would you like to tell us a little bit about WEZESHA? Your new strategy.
A new wow
What's the wow?
working way.
While the WEZESHA program builds on the foundation of 20 years of CARE's work in Tanzania, it embodies a more unified... Sorry, that's wrong.